Hello, I'm Sheryl McCarthy of the City University of New York. Welcome to One to One. Each week, we address issues of timely and timeless concern with newsmakers and the journalists who report on them, artists, scientists, educators, social scientists, government leaders, politicians, all are one to one. I'm pleased that Dr. Marjorie Hill, CEO of the Gay Men's Health Crisis, the nation's oldest AIDS service organization, can join us today. GMHC brings a host of services to HIV-positive men, women, and children. It educates those at risk to avoid contracting HIV and AIDS, as it helps dispel the myths surrounding the illness. Dr. Hill's past work for a variety of government agencies has prepared her well for navigating against the tide during these economic hard times. Welcome.
Hi.
So how did an African-American woman get to be head of the Gay Men's Health Crisis?
How much time do you have?
Well, give me the short version.
You know, people often ask me that about GMHC, and it is interesting because of our 15,000 clients, 2/3 of them are people of color. 25% of our clients are women, and overwhelmingly those women are predominantly African American. So in some ways, an African American woman at the head of GMHC at this point in time is very appropriate.
You represent, the changed demographics.
I represent really where the epidemic is, and for some of us believe there have always been racial disparities around HIV, and we are just really beginning a sense of that.
What drew you to this work?
I had a friend in college. Her name was Lorraine. Lorraine and Sharon and I hung out together. She married her high school sweetheart, moved to San Francisco, and we lost touch, and then I got a call that she had been diagnosed with GRID. And I said, she can't have GRID, gay-related immune deficiency, which is what they called before AIDS. It's what the symptoms were called, and that was 1982. Lorraine came back to New York and died very shortly thereafter. But I just remember having a friend that had a mysterious illness that we knew nothing about.
Because that was right in the beginning.
It was in the very beginning. Right. And it really, that curiosity and that pain really shaped my career.
Wow. Did she contracted it from her husband or
from her husband?
Okay. So let's talk about the demographics of the whole HIV/AIDS thing. Is it, in the beginning and for a number of years, it was connected with gay white men. Are they still the majority of people with HIV/AIDS or not?
Well, it's interesting. I mean, I think when we look at the absolute numbers, that men who have sex with men or gay men, actually of color, are the largest proportion of individuals affected by HIV. And so the combined challenge of race, particularly African American, and being gay is a very high risk factor. But women of color, especially African American women, are increasingly at risk. And then the third area are young people, individuals 25 and under. We believe in part that's because young people didn't see the kind of travesty that many of us witnessed in the early days of the epidemic and say, there's a pill, I can take it, nothing to worry about.
Do we know how many people nationwide are HIV positive or living with AIDS?
Well, the CDC just came out with new numbers. They had been giving us saying there were about 1 million persons affected by HIV in the United States, about 40,000 new cases every year. This August, through some sophisticated scientific techniques, they reevaluated those estimates and said there are about 53,000 new cases every year. So that's a 40% higher number. And so, and New York City continues to be the epicenter of the epidemic. So we have about 3 times what is the national average.
Well, do you know what the absolute number is in New York City?
I don't have the number on the top of my head yet.
Has New York always been the epicenter, or was it, I mean, you sort of felt that San Francisco was at one time, but maybe I'm mistaken.
New York has always been the epicenter, and we have more cases than Los Angeles, San Francisco, Miami, and Washington, D.C. combined.
How did it go from being a largely white, gay man's disease to being largely African-American men and women? What brought about that shift?
So that's a really good question, and I think that part of it is that we believe that there were individuals who had symptomatology earlier in the epidemic, women of color and gay men of color who simply just weren't diagnosed. So while there is an increase, we don't think it is the dramatic increase that everyone is noticing. At the same time, I think that sexuality is very fluid, and people often have very complex sexual lives, and individuals who may or may not identify as gay, may or may not be mostly not in monogamous relationships. And so because HIV is a sexually transmitted disease for the most part, individuals who have sexual relations with persons are at risk. And so it's not the kind of neat, tight kind of disorder that just, that you can contain in the same way that perhaps you can contain something like TB.
Yeah. We have for many years spoken of the HIV/AIDS situation as a crisis. Is it still a crisis, or is it at a different stage right now?
It is very much a crisis. We see lots of attention given to the AIDS crisis in Africa and in other parts of the underdeveloped world. But if Black Americans would constitute a country, those numbers of HIV would rank us 7th in the world in terms of HIV. And that's a crisis when we have a disease that is preventable, but yet places like Washington, D.C. have one of the highest incidence rates in the country. We can do better. I think the other challenge is that while it is a medical condition, there are social conditions that promote HIV.
What are they? What are those?
Poverty, lack of education, homelessness, substance abuse, all of those, incarceration, all of those individually and combined increase a person's risk. And the combined risk makes a person much more vulnerable.
Are there other trends in terms of who has HIV/AIDS? Are there more older people, for instance, with the
Well, it's interesting because there is kind of this two spectrums that people often don't think about. Younger people, as I said, under 24, increasing new cases in that age group, and persons over 50. And the over 50 group, my group, is one in which there are two challenges. People with HIV are living longer, so they are getting older, and that's increasing the pool. But there also are new cases of people newly infected who are over 50, individuals who are newly separated or divorced or widowed, who have been in exclusive monogamous relationships for many years.
And then they get back out there.
They get back out there and start dating, and a little bit of Viagra goes a long way, and therefore it really is creating a challenge in terms of that particular age group that's not getting the information and not getting the support, and therefore are unprepared and therefore more at risk.
Is HIV/AIDS now pretty much a chronic disease as opposed to a fatal one?
Well, I think the best way I want to answer that is there is no cure, there is no vaccine, and while there are treatments, the treatments can be toxic. The treatments are very expensive, and individuals can, in fact, develop resistance to treatment. So I don't want to paint a complete doomsday picture.
Right.
The reality is that medications have vastly changed HIV epidemic and have provided new hope. We have clients at GMHC who said to me they thought they were going to die.
Right.
They were literally on death's door and got on a medication treatment that allowed them to live useful, productive lives.
But what is it like being someone who is living with AIDS?
You know, it's a question that I hesitate because living with HIV is often just one part of a person's life. So I run a group, for example, of African-American women, primarily African-American women living with HIV, most of them for over 10 years. In that group, we have homemakers, we have professionals, we have a flight attendant, and we have someone who is on disability because her health does not allow her to work. And so some of them are married, some of them are dating, some of them decide they don't want to date right now. You know, some of them are very active in their church communities, in their faith communities.
So it's very possible, it runs the gamut, but it's very possible to live a relatively normal life, but others are sicker.
Others are sicker.
Yeah.
And people still die.
I was going to ask you about that because I remember when you used to, I guess, see the movies and maybe documentaries about the AIDS wards in the hospitals where everybody's just so terribly, terribly sick and dying. Is that still a reality?
Not to that extent. That again, the medications have really made a significant difference in terms of longevity.
Right.
But there are deaths. We had a staff member die a few months ago, and in some ways it was harder for us in terms of our reaction because we had not had someone on staff die of AIDS for many years.
Right.
But it still happens.
Yeah. We're going to take a short break. I'll be back with more with Dr. Marjorie Hill, the CEO of the Gay Men's Health Crisis Center.
Can lead to great things. Find out how a healthy lifestyle can help your child succeed.
Welcome back to One to One. I'm Sheryl McCarthy of the City University of New York, and I'm talking with Dr. Marjorie Hill, CEO of the Gay Men's Health Crisis. In my mind, I mean, I tend to think of GMHC as primarily an advocacy organization, but you're not. I mean, you are really a service organization. Tell me what you do and the kinds of services you offer.
Well, you know, GMHC is a full-service, one-stop shop in which a person comes in. We provide free HIV testing and counseling. We make sure a person gets medical care. We have a clinic with New York Presbyterian on the first floor. We provide legal services, meals, workforce development, GED. We have a entry program for college. We do arts and crafts and Reiki and acupuncture. We provide treatment adherence, treatment support, all kinds of groups, nutritional counseling, and we also do public policy and advocacy.
Tell me about the college. I'm intrigued by the college group. What does that do?
Well, we've had a GED program for many years, and a couple of years ago, 2 of the students announced at our graduation, we always have a graduation, that they were, they had been accepted to, I think actually one was going to Hunter. And the rest of the students said, well, I want to go to college and we need support around that. The GMHC clients are not shy. And so we then started doing college support to help individuals with applications, early entry, and just supporting them around college work.
How many people do you service in the course of a year?
We see 15,000 clients annually, and our social messaging and outreach probably reaches millions.
And who supports you financially? Where does the support come from?
Our $31 million budget is about 50% government and 50% private. So we're very appreciative of our government support and appreciative of the corporations, foundations, and individual donors that make our work possible.
In the 80s, a lot of people were afraid to be tested for HIV/AIDS because at that time a positive diagnosis was considered tantamount to a death sentence. Has that changed?
Only a little bit.
Really?
Unfortunately, there's still humongous stigma around HIV. People will say to me, I just want to know something for a friend. Okay, I just want to know where a friend can go and get tested. I've made reference to the support group that I run as a psychologist, and there are 6-7 women in the group have been living with HIV at least 10 years, some as long as 16 years. 3 women in the group have not told their sisters. Their sisters. And it's because, and I asked them about it, and she said, you don't know my sister. If I told her, she would not let my niece and nephew come and eat. We have a program that specifically provides support to older persons. And as one woman said, I don't need a doctor, I don't need help with my medication, that's all fine. But can you talk to my daughter? Because she will not let me hold my grandbaby.
Wow, wow. But do you have a sense that more people are getting tested or than used to, or a higher rate of testing?
Well, more people are getting tested.
Yeah.
I mean, it's a very key component of the work that we do. We offer free testing every day at GMHC, but we also have a mobile van. So we go out to churches, we go to beauty parlors, we go to gay clubs, we go wherever people are and offer HIV tests. But the challenge is that 1 in 4 New Yorker right now that has HIV does not know it. So we have a lot of work to do.
How about and you alluded to this, the public perception of HIV/AIDS, has that changed? Is discrimination against HIV-positive people still an issue?
You know, although we have the American with Disabilities Act, which covers HIV, and although it's, you know, it's totally illegal. I mean, people are evicted from their apartments. Their landlords really, when they find out that they are HIV positive, put them out, and that's illegal. And so we are one of the biggest pieces of work that our legal department does is around housing and eviction, both prevention and getting people back in their homes. I wish it wasn't true, but stigma is still paramount. And there are many people who believe that, contrary to the numbers, that it's still a white gay thing. So they don't have to worry. Even though when you ask people, do they know someone, you know, who has died from HIV, who's, you know, died from AIDS, who's living with HIV?
They probably do.
They do, but they sort of say, no, not me.
Yeah. Safe sex, but before I get to that, have the needs of HIV-positive people changed?
They've become greater, actually. For one, people are living longer. And so there are medical issues, I mean, you know, in terms of diabetes, cholesterol, and there's some of the things that tend to happen in persons as they age also happen in persons who are living with HIV. And so they have a compromised immune system. There are more medical challenges, but also around isolation. If you're meeting new people, whether it's dating or what, the whole issue of disclosure. Do you disclose on your job? Do you disclose to your faith community? Do you disclose in your family? It's, it's an additional challenge.
That's got to
and
be very
burden.
tough, yeah, for a lot of people. Safe sex has long been one of the mantras of the effort to control HIV/AIDS. And for a while, it seemed that people were getting on board, and practicing safe sex and shut down the bathhouses and that you can't have, 100 partners in a year. Has that, or have they kept up with that? I mean, are people practicing safe sex or not? Has that changed?
Well, the numbers indicate that people are not practicing safer sex. And when we do interviews with individuals on the street, we do a certain amount of research, as well as when we interview clients, people kind of say, well, sometimes I do and sometimes I don't, or I mean to, or I hope to, or I want to, which essentially means no.
Yeah.
I think that one of the issues is that people, sexuality is very fluid and people get very caught up in the moment. If an individual is under the influence of drugs or alcohol, a couple of beers, a couple of glasses of wine, they're a little bit less concerned.
Right.
And so
right.
we really promote and teach safer sex, and we try to sort of instill it, kind of like you get up in the morning, you brush your teeth, you're going to have a sexual encounter, you practice safer sex. But it has to be reinforced. Mm-hmm. The schools are not doing enough. The faith communities are not doing enough. Businesses are not doing enough. We often say that safer sex discussions need to happen in the boardroom, in the classroom,
right.
and in the bedroom.
Mm-hmm. And I know there was some talk that, practicing safe sex was a harder sell within communities of color. I don't know if that's true or not. I don't know if do you have any thoughts about that, or?
I think that people, sexuality is a human blessing, gift. And it is already complicated. Unfortunately, we don't provide young girls and young men with the tools and the information and the language around which to discuss sex and sexuality. So it's no wonder that when they start experimenting and having relationships, that they don't know how to talk. Mm-hmm. And you can't really negotiate if you can't talk.
Right, right. You mentioned the cost of the drugs. Is that a huge problem, and is that preventing people from getting treatment?
It is a huge challenge. Here in New York State, we're fortunate that our state does in fact use a lot of its funds and supports, it's called the AIDS Drugs Assistance Program, and individuals who are challenged financially can get their HIV medications, but that's not true across the country.
Other states, I would think.
And one of the things that GMHC, in terms of our advocacy role, has called for is a national AIDS strategy that would in fact look at the challenges of HIV and really figure out what needs to happen and what are the priorities. And we're very pleased that President-elect Obama, as a candidate, endorsed it, and as recently as World AIDS Day, released a statement reiterating his commitment to have a national AIDS strategy.
How do you envision, you got about 2 minutes left, how do you envision the future of your organization and the future of the disease? I know it's a big question.
When I first took this job as CEO about 2 years ago, I think I was thinking that during my watch, we would significantly see a drop in HIV. I think in some ways what I want to see are more HIV cases identified. We want everyone listening to me, everyone who reads us, everyone who goes to our website, to get tested and to know their HIV status. That information can make the difference between life and death for them, for their partners, and the quality of life for their families.
Do you think we're moving towards, I mean, there's been all kinds of AIDS research, are we moving towards finding a vaccine or towards finding a cure, or what?
We are moving towards both a vaccine and a cure, but very slowly. The decisions that we make as individuals on a daily basis
are the
important decisions. We can't wait for a vaccine, we can't wait for a cure, but we can use condoms and common sense.
We're out of time. I want to thank Dr. Marjorie Hill, Chief Executive Officer of the Gay Men's Health Crisis for the City University of New York and 1-to-1. I'm Sheryl McCarthy.